Hello everybody, I'm Jack.Vilin. Today in this video I'm teaching you topic called pulmonary tuberculosis, and this is from the subject called medical surgical nursing 1. The system is respiratory system. As well with TB, when the word TB comes to our mind, the first thing strikes us, the person will be coughing and will be weak, and it's a communicable disease. It's a common thing most of us know. But we'll see what actually tuberculosis is. The definition of tuberculosis is it is an infectious disease primarily affecting lung parenchyma. Lung parenchyma is a tissue present inside the lung, and it is most oftenly caused by Mycobacterium tuberculi. The main causative organism for tuberculosis is the bacteria called as Mycobacterium tuberculi, and it may be spread through any part of the body. It is an airborne disease. When the person, already affected person, when he coughs out, the infectious agent has been suspended in the air, and when the other person inhale the same suspended bacteria, then the person will get the same tuberculosis. That is how this. The next one is causative agent. As you can see in the screen, this is how it colonizes. Once it enters to the airway, it colonizes in the particular area of lung parenchymal tissue, and it starts to multiply and then causes signs and symptoms. The etiological factor, that's what causes the main causative organism, we already know, that is Mycobacterium tuberculi. The other families of tuberculi is Mycobacterium tuberculosis, Mycobacterium bovis, Mycobacterium africanum. These are the other bacteria which causes. And then mycobacteria, what happens is when around 15 are organized or recognized as pathogenic from the Mycobacterium family, most of the subdivision of this bacteria are like around 15, which mainly recognized as, which called affect to the human body. And then Mycobacterium leprae, which causes leprosy. This also belongs to the same family. The risk factor, people who are very prone to get this disease are people who are alcoholic, drug abusers, and then those whose immune system is very low, and old age people, and then people who immigrant from one country to other country are high chance of getting this TB. And then occupational health, people who work under closed contact and all can get. And the mode of transmission I already said, it is a droplet infection which spreads through airborne disease. There are two types of TB, mainly called as primary tuberculosis and secondary tuberculosis. We'll see what is primary tuberculosis. The infection of an individual who was not previously affected or immunized is called primary tuberculosis. Like the person who has got tuberculosis for the first time. It is not episodes of TB again and again has been occurring. No. For the first time when a person gets TB and the person is not being immunized. And you can also call it as this kind of infection, we also call it as gone focus complex. This mostly affects children, and the tissue involving here is primary complex are lungs and lymph nodes. These are tissues which are affected in primary tuberculosis. When it comes to secondary tuberculosis, this infection spreads for the individual who have been previously infected and sensitized is called as secondary infection. Like people who already got tuberculosis and cured for it, and there are chances of recurrence of the tuberculosis again. So this kind of TB is called as secondary tuberculosis. When this episodes of TB occur again and again, this episode repeats like every 3 times in 1 year. So this kind of infection called as chronic tuberculosis. Okay, so this is second. Now we'll see what are the pathological changes which takes place in the body. Once the bacteria enters our body, there will be changes, that is our immune system responds to it, and there will be changes takes place. Mostly affected parts are the tissues of our body. Now that is only called as pathological changes. Now we'll see how it actually happens. Once the bacteria is entered inside the body through the causes of the respiratory system, through the nose, when the bacteria is inhaled, it logged inside the alveoli. Alveoli is a part of our lungs. That is where the gas exchange takes place. Inside the alveoli, it lodges, and then it initiates recruitment of macrophages and lymphocytes. Macrophages undergo transformation into epitheliolite and then Langerhans cells, which aggregates lymphocytes from tuberculosis granuloma. And next what happens is there is number of granulomas aggregate to form primary lesions. So all these granules, what happens, it forms together and it becomes primary lesions, or these primary lesions are also called as Gons focus. Gons focus, which is situated in the peripheral of the lungs. Periphery means the end part of the lungs, in the sidewise. And then it looks like pale yellow caseous nodules. Caseous means it looks like a cheesy formation. We already know when the particular tissue has been affected, there will be pus collection, full fluids will be there. The appearance of that pus and the tissue, dead tissue all together looks like cheesy, like melted cheese. So that is what we call as caseous nodules, which will be like 1 to 2 centimeters in diameter. This, what happens after this is, this repetitive process encases the primary complex in fibrous. These gone focus, what has been formed, that is called primary lesions. Later it becomes fibrous capsules, and then this limits the bacteria spread of bacilli. This is called a latent TB. When the process of primary complex becomes into fibrous capsule and limiting the spread of bacilli, this kind of changes when it takes place. This is called latent TB. And after this latent TB, what happens is healing then occurs with late calcification of granules. In the beginning, before the formation of gone focus, we already saw that there was granulomas. Granulomas then converted into aggregate together and form primary lesions, which is called as gone focus. After that it became caseous, and then after that it became fibrous, and then now it has become calcification. And after this, the combination of calcified peripheral lung lesions, hilar lymph nodes known as Gons complex. The lesions first we called as Gons focus. Now it has turned into Gons. Now we'll see how we're going to test the person who are having TB. To confirm TB, what the test should be taken are listed here. First one is history collection. In history collection, we'll be asking the patient to what area they were exposed to, what do they work, what is their occupational status, and then physical examination such as we'll check for the clubbing and crackle sound from the chest, like when they respire, we'll auscultate the chest, the breathing sound, we can hear a crackle sound in that. And the other test includes like biopsy, that is tissue culture, and then bronchoscopy. Bronchoscopy is a visualization of the bronchus through a tube which is inserted to the respiratory tract, and then chest x-ray, CT scan. In this one you can find out how much area has been affected. And then the other topic called as thoracentesis. Thoracentesis, we can also test the thoracic fluids to find out what particular mycobacterium is causing this TB. And through thoracentesis, we can even remove the fluid collected inside the pleural cavity. So in this thoracentesis, it is a procedure to cure the TB as well as to test the TB also. And other examination are like a sputum examination, tuberculin test. This tuberculin test is a very important test when it comes to find out TB. This tuberculin test is also called as PPD, that is precipitated protein derivative. This precipitated protein derivative has been extracted and then it is injected to the forearm intradermally, and there will be a marking of circular marking around the injured area to find out whether the person is allergic or there is a reaction taking place for the PPD or whether it is not. The swelling of the PPD test injected area will be swollen. If at all it is a swollen, then there is a confirmation positive. If it is not swelling, then it is negative. The finger toe of the person will be advanced diseases, swelling will be there, tender of the lymph nodes, neck and other areas, and there will be fluid around the lung. Unusual breathing sound will be found out in all this. And then the particular tuberculin test, as I already taught in the previous slide, that is 0.1 ml of PPD is injected on the forearm, and then after 48 to 72 hours we should check for the injected site. If at all the duration is equal to the more than 10 centimeter, it is positive, tuberculin is positive. If at all there is no swelling, then the test is negative. This is the tuberculin test mainly done for tuberculosis. The complication. If at all the TB is not treated, the person is very much prone to get bone diseases such as spinal pain and then joint destruction, and then pot spine, the brain meningitis might cause, liver and kidney will be damaged, cardiac tamponade will be there, pleural effusion, TB pneumonia. The person who's having TB can also get pneumonia because of the fluid collection inside the body. And there's a serious reaction of the drug therapy because the drug which is given for the TB is very high doses and it has major side effects. If the person is taking for longer duration, he has serious reactions such as hepatotoxicity and hypersensitivity. The next one, medical management. How are we going to treat the other than tablets? Pulmonary TB is treated primarily with anti-tuberculosis agent for 6 to 12 months, and these medicines are mainly frontline anti-tuberculin medications called as streptomycin, isoniazid, rifampicin, pyrazinamide, and then ethambutol. These are the very major medicines which is given for TB treatment. I'll repeat it again because these are the very important medications which you should never ever forget in your life. That is streptomycin, isoniazid, rifampicin, pyrazinamide, and then ethambutol. These are the medications given for TB treatment. In case of severe TB, these medications can be altered and given in a combination wise, so that can also be treated. Second line medications such as capreomycin and then ethiomide and then paramazeride and then vitamin medications and then cycloserine. These are the medications which is given as second line medications for TB treatment. The other one is DOTS. The word DOT is directly observed treatment short course. Like when we are administering medication to the patient, this should not be discontinued at any cost, because if the person discontinued the medication, the next time when the person takes the same medicine for the TB, it will not affect the body because the body will get used to it and there will be no reaction, or the medication action will not be going on in a well way. So we'll see what actually DOTS is. DOT is the name given by the WHO, World Health Organization. This is recommended for TB treatment to strategy components such as government committed this DOT, such as including the both political as establishing the centralized and prioritizing system of TB monitoring. The other cases, the case detection by sputum, smear microscopy, standardized treatment regimen directly observed to the healthcare workers. What I'm telling you here, the main aim of this DOTS is to observe the patient whether the person is taking medications properly or not exactly at the given course of duration, and the regular supply of the drug should be maintained, standardized recording of the medication, and the patient should be reported properly. So this is what the main components of DOTS are. The next one is nursing management. As a nurse, what are our jobs to do in this topic? To cure a TB patient, as a nurse, what is our work is, first we have to assess the patient and then obtain the history, to what kind of a patient has been exposed, and then assess for the symptoms, whether it's active or inactive, and then auscultate for the crackle sound, and then find out the drug therapy, assess for liver function, etc., and should give the medications as prescribed by the doctor, and DOTS should be maintained properly. And the other nursing diagnosis, like ineffective breathing pattern related to pulmonary inefficient and potential for long-term carrying with decreased lung capacity. Based on the nursing diagnosis, intervention should be given. And then the next another nursing diagnosis, risk for spreading infection related to nature of disease and the patient symptom, because when it comes to TB, it is a communicable disease, because when the person coughs out, all the bacteria are suspended in the air. So other people, when they inhale it, even they are very much prone to get the TB. That is why risk for spreading infection should be controlled by the nurse by maintaining all the protocols. And then how we are going to prevent the TB is, first we have to isolate the patient. The person who are having TB or tuberculosis, the person should be isolated in a different room, and there should be a name plate or the name board attached to the door, because the communicable disease isolation will prevent the spread of TB. And then ventilation of the room should be maintained, so that airborne disease should not be stagnated in the same air, it should be ventilated out. So that is why the windows in the area where the patient is isolated should be open and it should be ventilated enough. And we should ask the patient to cover the mouth while coughing, wear mask. The people should reduce the visit of any family members or any other peer group to the patient because of communicable disease, and finish entire course of medication because the strict rules of it for given by the doctors and the government as well. Vaccination should be given because nowadays we all are following vaccination to the newborn baby. After within a year, the vaccination given is BCG, that is Basil Calmette Guerin. BCG, the full form of BCG is Basil Calmette Guerin. It is a vaccination particularly made to prevent tuberculosis. So I'll just conclude the topic in this video. Today I taught you about the pulmonary tuberculosis, how it spreads, how it is being tested, how we can control it, and what are the medication to prevent it. So this and all I taught in this video. Most probably the person to avoid or to self-prevent this TB is to be immunized well and to maintain a healthy habit, should avoid smoking, and these are the good habits. When they follow, the person is very less chances of getting tuberculosis. So if anybody having if at all anybody having any doubt regarding this topic, can contact me. Thank you for watching the video.